Tell me about your experience in managing trauma patients.
I have extensive experience managing trauma patients in high-pressure ER and ICU settings, where I have assessed and stabilized individuals with critical injuries resulting from accidents and other traumatic events. My approach prioritizes rapid and effective care, collaborating closely with multidisciplinary teams to ensure optimal patient outcomes. I am proficient in rapid assessments, administering emergency medications, and providing advanced life support, with a focus on managing conditions such as head injuries, fractures, and internal bleeding. Alongside my clinical expertise, I emphasize compassionate care, remaining calm under pressure, thinking critically, and adapting to rapidly changing situations. One notable example of my experience occurred during my time in the emergency department at Mihira Hospital. A 32-year-old male was brought in following a severe motorcycle accident, presenting with multiple traumatic injuries, including a fractured femur, suspected internal hemorrhage, and a head injury. The situation was critical, and my immediate task was to stabilize the patient while coordinating with the trauma team to ensure timely interventions. I initiated advanced trauma life support protocols, securing the airway, establishing access, and administering fluids to maintain hemodynamic stability. I closely monitored his vital signs, recognizing early signs of hypovolemic shock, and promptly communicated this to the attending physician. Additionally, I assisted in preparing the patient for an emergency CT scan and subsequent surgery, while maintaining clear and concise documentation of all interventions and the patient's response to treatment. Thanks to the team's coordinated efforts, the patient stabilized and was successfully transferred to the ICU for further management. He eventually made a full recovery and was discharged after 6 weeks of rehabilitation. This experience reinforced my ability to remain calm under pressure, prioritize critical tasks, and collaborate effectively with multidisciplinary teams to achieve positive outcomes for trauma patients.
Describe a time you had to make a critical decision quickly in a trauma situation.
During my time working in the emergency department at City Hospital, I encountered a situation that required me to make a critical decision quickly. A 45-year-old patient was rushed in after a high-speed car collision, presenting with severe chest trauma, difficulty breathing, and signs of respiratory distress. The situation was urgent, and my task was to assess the patient, stabilize their condition, and determine the next steps in their care. Upon initial assessment, I noticed the patient had diminished breath sounds on the left side, a deviated trachea, and subcutaneous emphysema, which led me to suspect a tension pneumothorax. Recognizing the life-threatening nature of this condition, I knew immediate intervention was necessary. I quickly gathered the necessary equipment and prepared for a needle decompression, while simultaneously coordinating with the trauma team to prepare for a chest tube insertion. I explained the situation to the team and ensured everyone was aligned on the plan of action. I performed the needle decompression at the second intercostal space, midclavicular line, which immediately relieved the pressure and improved the patient's breathing. The trauma team then proceeded with the chest tube insertion, and the patient was stabilized. Throughout the process, I remained calm and focused, prioritizing clear communication and precise execution of interventions. As a result of the quick decision-making and coordinated efforts, the patient's condition improved significantly, and they were transferred to the ICU for further monitoring. This experience highlighted my ability to assess critical situations rapidly, make informed decisions under pressure, and take decisive action to save a patient's life. It also reinforced the importance of staying composed and relying on clinical expertise in high-stakes scenarios.
How familiar are you with different types of trauma injuries and their management?
I am highly familiar with a wide range of trauma injuries and their management, having worked extensively in emergency and critical care settings. My experience includes managing blunt trauma, such as injuries from motor vehicle accidents or falls, which often involve fractures, internal bleeding, or organ damage. I am skilled in performing rapid assessments, stabilizing patients with cervical spine precautions, and administering appropriate interventions like fluid resuscitation or pain management. I am also experienced in managing penetrating trauma, such as stab wounds or gunshot injuries. In these cases, I focus on controlling hemorrhage, ensuring airway patency, and preparing patients for emergency surgical interventions when necessary. Additionally, I have managed burn injuries, ranging from minor burns to more severe cases requiring fluid resuscitation, wound care, and infection prevention strategies. Head injuries are another area of expertise for me. I am proficient in assessing and monitoring patients with traumatic brain injuries, TBI, including performing neurological evaluations, managing intracranial pressure, and recognizing signs of deterioration that require immediate intervention. My training has equipped me to handle the complexities of these cases, ensuring timely and effective care. To further enhance my skills in trauma care, I have completed specialized training and certifications, including the Trauma Nursing Core Course, TNCC, and Advanced Trauma Care for Nurses, ATCN. These certifications have provided me with advanced knowledge and hands-on experience in trauma management, enabling me to deliver evidence-based care in high-pressure situations. My combination of clinical experience and specialized training ensures that I am well prepared to manage a diverse range of trauma injuries effectively.
What specific skills do you possess that make you a strong trauma nurse?
As a trauma nurse, I possess a combination of technical expertise and soft skills that enable me to deliver high-quality care in fast-paced and high-pressure environments. My advanced assessment skills allow me to quickly identify life-threatening conditions and prioritize interventions effectively. For example, I am proficient in performing rapid trauma assessments, recognizing subtle signs of deterioration, and initiating appropriate treatments promptly. I have extensive experience in critical procedures such as fore insertion, including establishing large bore for access for rapid fluid resuscitation, as well as advanced airway management techniques, including assisting with intubation and managing ventilators. My wound care skills are also well developed, ranging from basic wound cleaning and dressing to managing complex traumatic wounds and burns. These technical skills are essential in stabilizing trauma patients and ensuring they receive timely and effective care. In addition to my clinical skills, I excel in communication and teamwork, which are crucial in trauma settings. I collaborate closely with physicians, paramedics, and other healthcare professionals to ensure seamless care coordination. For instance, during trauma resuscitations, I actively communicate patient status updates, anticipate the needs of the team, and provide clear handoffs during transitions of care. My ability to remain calm and composed under pressure allows me to think critically and adapt to rapidly changing situations, ensuring that patient care is never compromised. Furthermore, I am highly organized and skilled at prioritizing tasks in a fast-paced environment. Whether it's managing multiple trauma patients simultaneously or responding to unexpected complications, I can quickly reassess and adjust my approach to meet the demands of the situation. My adaptability and resilience have been honed through years of experience in high-acuity settings, making me confident in my ability to handle the challenges of trauma nursing. Overall, my blend of technical proficiency, strong communication skills, and ability to prioritize and adapt makes me a strong trauma nurse. I am committed to providing compassionate, evidence-based care while supporting my team and ensuring the best possible outcomes for my patients.
How do you stay up to date with the latest advancements in trauma care?
Staying up to date with the latest advancements in trauma care is a priority for me, as it ensures that I can provide the highest standard of care to my patients. One of the ways I achieve this is by regularly participating in continuing education courses, such as the Trauma Nursing Core Course, TNCC, and Advanced Trauma Care for Nurses, ATCN. These courses not only reinforce my foundational knowledge but also introduce me to new evidence-based practices and emerging trends in trauma management. I also make it a point to read professional journals, such as the Journal of Trauma Nursing and Critical Care Nurse, to stay informed about recent research and clinical guidelines. These resources provide valuable insights into innovative treatments, best practices, and case studies that I can apply to my own practice. Additionally, I attend trauma-focused conferences and workshops whenever possible, such as those organized by the Society of Trauma Nurses, STN, or the Emergency Nurses Association, ENA. These events offer opportunities to learn from leading experts, network with peers, and gain hands-on experience with new techniques and technologies. Furthermore, I am an active member of professional organizations like the Society of Trauma Nurses and the Emergency Nurses Association. Membership in these organizations grants me access to exclusive resources, webinars, and forums where I can engage with other trauma care professionals and discuss challenges and solutions in the field. This collaborative environment helps me stay informed and continuously improve my practice. By combining these approaches, continuing education, professional literature, conferences, and organizational involvement, I ensure that my knowledge and skills remain current and aligned with the latest advancements in trauma care. This commitment not only enhances my ability to provide exceptional care but also contributes to the overall success of the trauma team and the well-being of our patients.
A trauma patient arrives with multiple injuries. How do you prioritize your actions?
When a trauma patient arrives with multiple injuries, my priority is always rapid assessment and stabilization, following the ABCDE approach. First and foremost, I immediately assess the patient's airway. Is it patent? Are they maintaining spontaneous respirations? If not, I'm prepared to secure the airway through interventions like oral or nasal intubation, depending on the situation. Simultaneously, I'm checking their breathing. Are they breathing effectively? What is their respiratory rate and depth? I'm looking for any signs of respiratory distress, like accessory muscle use or paradoxical chest movement. If there are breathing issues, I'll administer oxygen and assist with ventilation as needed. Next, I move to circulation. I'm checking for a pulse, assessing capillary refill, and looking for any signs of active bleeding. Establishing fore access is crucial at this stage, so I'll insert large-bore catheters to administer fluids and medications as needed. Controlling any external bleeding is paramount, and I'll apply direct pressure or use other appropriate methods to achieve hemostasis. After addressing the ABCs, I assess the patient's disability, which involves a quick neurological assessment. I'm checking their level of consciousness using the Glasgow Coma Scale, looking for any signs of head injury, and noting their pupillary response. Finally, I expose the patient, removing their clothing to fully assess the extent of their injuries. Throughout this entire process, I'm constantly reassessing and prioritizing based on the patient's changing condition. Communication is also key. I'm relaying my findings to the trauma team, ensuring everyone is aware of the patient's status and the plan of care. This systematic approach, combined with constant vigilance and effective communication, allows me to provide the most effective and timely care to trauma patients with multiple injuries.
Describe a challenging trauma case you encountered and how you handled it.
One particularly challenging trauma case I encountered involved a young man who was brought to the emergency department after a serious motorcycle accident. He presented with multiple injuries, including a suspected traumatic brain injury, a fractured femur, and significant internal bleeding. Initially, his airway was compromised, so we immediately intubated him to secure it. As we began our initial assessment, it became clear that his blood pressure was dropping rapidly, and he wasn't responding to initial fluid resuscitation. We quickly identified that he had a large hemothorax, blood accumulating in his chest cavity, which was further complicating his respiratory status and contributing to his hemodynamic instability. What made this case particularly challenging was that, in addition to his physical injuries, he became increasingly agitated and combative as his level of consciousness fluctuated, likely due to his head injury. This made it difficult to perform necessary procedures and assessments. My role in this case was multifaceted. While the surgical team prepared for a chest tube insertion to address the hemothorax, I focused on maintaining his airway, administering blood products, and continuously monitoring his vital signs. Because of his fluctuating mental status, I had to be particularly creative in how I communicated with him. I spoke calmly and reassuringly, explaining what we were doing even if I wasn't sure he fully understood. I worked closely with the other nurses and the physician to ensure we were all on the same page, constantly reassessing his response to our interventions. When he became agitated, I collaborated with the team to ensure his safety while also trying to minimize the use of restraints, opting instead for verbal de-escalation techniques whenever possible. Ultimately, the surgical team was able to stabilize his chest injury, and he was transferred to the ICU for further management. This experience reinforced the importance of several key skills in trauma nursing. First, it highlighted the absolute necessity of being able to adapt to rapidly changing situations. This patient's condition deteriorated quickly, and we had to adjust our plan of care on the fly. Second, it underscored the importance of interprofessional collaboration. The successful management of this complex case relied heavily on the seamless teamwork between nurses, physicians, surgeons, and other members of the healthcare team. Finally, this case taught me the value of persistent and creative communication, especially with patients who have altered mental status. Even though I wasn't sure how much he was comprehending, I felt it was essential to treat him with respect and dignity, explaining what we were doing and offering reassurance. From this experience, I learned to be even more flexible, collaborative, and patient in my approach to trauma care, and it solidified my understanding of the critical role communication plays, even in the most challenging circumstances.
How do you handle the emotional stress of working in a trauma environment?
Working in a trauma environment is undeniably emotionally demanding. Witnessing the impact of severe injuries and the suffering of patients and families can take a toll. I've learned that acknowledging this emotional impact is the first step to managing it effectively. It's not about becoming desensitized, which I believe is detrimental to compassionate care, but rather about developing healthy coping mechanisms. For me, this involves a multifaceted approach. Outside of work, I prioritize activities that help me de-stress and recharge. Regular exercise, even something as simple as a brisk walk, is crucial for both physical and mental well-being. Spending quality time with loved ones is also essential. Their support and understanding provide a much-needed balance to the intensity of my work. I also find that mindfulness practices, like meditation or deep breathing exercises, can be helpful in managing stress and staying grounded, especially during particularly challenging shifts. Within the work environment, I rely on my colleagues for support. We often debrief after difficult cases, sharing our experiences and emotions. This peer support is invaluable, as we understand the unique challenges of trauma nursing. I also believe in the importance of self-reflection. After a particularly difficult shift, I take some time to process what happened, acknowledge my feelings, and identify any areas where I might need additional support or training. I'm also not afraid to seek professional help if needed. Talking to a therapist or counselor can provide a safe space to process complex emotions and develop more effective coping strategies. It's important to recognize that seeking help is a sign of strength, not weakness. Ultimately, I strive to maintain a healthy balance between my professional and personal life, prioritizing self-care so that I can continue to provide compassionate and effective care to my patients. It's a continuous process of learning and adapting, but I'm committed to ensuring that I can manage the emotional demands of this rewarding but challenging field.
How do you collaborate with the trauma team, including physicians, surgeons, and other healthcare professionals?
Collaboration with the trauma team is absolutely essential for providing optimal patient care. It's a dynamic process that requires clear communication, mutual respect, and the ability to work effectively under immense pressure. My approach to collaboration is grounded in the belief that every member of the team brings unique expertise and plays a vital role. Effective communication is the cornerstone of this collaboration. I strive to provide concise and accurate updates about the patient's condition, ensuring that everyone is on the same page. This includes relaying vital signs, assessment findings, and any changes in the patient's status promptly and clearly, using standardized communication tools like SBR, situation, background, assessment, recommendation, whenever possible. I also actively listen to the input from other team members, recognizing that their perspectives are crucial for developing a comprehensive plan of care. Working effectively under pressure is inherent in the trauma environment. I've learned to remain calm and focused even in the most chaotic situations, prioritizing tasks and communicating clearly and assertively. I understand that everyone is working under stress, so I strive to maintain a professional and respectful demeanor, even when time is critical. Respect for the roles of other team members is paramount. I recognize the expertise of physicians, surgeons, respiratory therapists, radiologists, and other specialists, and I value their contributions to the team. For example, in a recent case involving a patient with a complex abdominal injury, the trauma surgeon relied heavily on the radiologist's interpretation of the CT scan to make critical decisions about the surgical approach. My role as a nurse was to ensure that the patient was stable for the scan, communicate the surgeon's questions to the radiologist, and then relay the findings back to the surgeon quickly and accurately. This seamless communication and collaboration between different specialties was crucial for the patient's positive outcome. Another example might involve collaborating with the respiratory therapist to manage a patient's ventilation. I would communicate my assessment of the patient's respiratory status, and the therapist would use their expertise to adjust the ventilator settings accordingly. This collaborative approach, where each team member contributes their unique skills and knowledge, is what makes trauma care so effective. It's about working together, with a shared goal of providing the best possible care for the patient.
How do you communicate with patients and their families during a traumatic event?
Communicating with patients and their families during a traumatic event requires a delicate balance of providing clear, concise information while also offering empathy and compassion. It's a highly stressful time for everyone involved, and my approach is grounded in the understanding that these individuals are experiencing a significant crisis. My first priority is to introduce myself and acknowledge their distress. Even in the midst of a chaotic trauma bay, a simple, "I'm here with you," can make a world of difference. I try to create a sense of calm and reassurance, speaking in a clear, calm, and respectful tone. When explaining the patient's condition or the procedures being performed, I use simple language, avoiding medical jargon that might be confusing or overwhelming. I break down complex information into smaller, more digestible pieces, checking frequently to ensure they understand what I'm saying. It's crucial to be honest, but also to offer hope. I never make promises I can't keep, but I always emphasize that we are doing everything we can to help their loved ones. Managing emotional responses is a key part of this communication. Families often experience a range of emotions, from fear and anxiety to anger and grief. I allow them space to express these emotions, listening empathetically and offering comfort. Sometimes, a gentle touch on the arm or a reassuring nod can be more powerful than words. I avoid giving false reassurance, but I do offer practical support, such as directing them to the waiting area, explaining where they can find the chaplain or social worker, or simply offering a cup of coffee. I also understand that family dynamics can be complex, especially in stressful situations. I try to identify the designated spokesperson for the family and keep them informed of the patient's progress. If there are disagreements or conflicts within the family, I try to remain neutral and facilitate communication between them, encouraging them to focus on supporting each other and the patient. Ultimately, My goal is to provide not only clinical care but also emotional support to both the patient and their family, recognizing that they are all going through a tremendously difficult experience. It's about treating them with dignity and respect, acknowledging their emotions, and empowering them with information so they can navigate this challenging time with as much understanding and support as possible.
Trauma nursing can be emotionally demanding. How do you maintain your compassion and empathy while dealing with critically injured patients?
Trauma nursing is inherently emotionally demanding. Dealing with critically injured patients and their families exposes you to a range of human suffering, and it's impossible to remain completely unaffected. However, I've learned that maintaining compassion and empathy is essential for providing quality care, and that requires a conscious effort to manage the emotional impact of the work. It's not about separating myself entirely from the emotional reality of the situation, that would be counterproductive to compassionate care, but rather about compartmentalizing my emotions in a way that allows me to function effectively and provide the best possible care to my patients. This means acknowledging the emotional weight of the situation without letting it overwhelm my ability to think clearly and act decisively. I focus on the task at hand, on what I can do to help the patient in that moment, and that helps me to channel my energy into providing effective care. Outside of the immediate clinical setting, I prioritize self-care and stress management. Regular exercise is a crucial outlet for me, both physically and emotionally. It helps me to decompress and release the stress that accumulates during my shifts. Spending time with loved ones is equally important. Their support and understanding provide a crucial balance to the intensity of my work. I also practice mindfulness techniques, such as meditation and deep breathing exercises, which help me to stay grounded and centered, especially during challenging shifts. These practices help me to manage stress in the moment and to process difficult experiences afterward. Debriefing with colleagues is another vital tool. Sharing experiences and emotions with other nurses who understand the unique challenges of trauma nursing is incredibly valuable. It helps to normalize the emotional impact of the work and provides a sense of shared experience and support. Finally, I'm a firm believer in seeking professional help when needed. Talking to a therapist or counselor can provide a safe and confidential space to process difficult emotions and develop healthy coping strategies. It's a sign of strength, not weakness, to seek support, and I believe it's essential for maintaining long-term well-being in this demanding field. Ultimately, I strive to create a healthy balance between my professional and personal life, prioritizing self-care and emotional well-being so that I can continue to provide compassionate and effective care to my patients. It's an ongoing process, but I'm committed to managing the emotional demands of trauma nursing so that I can continue to make a positive difference in the lives of my patients and their families.
Describe a time you dealt with a particularly difficult or emotional case. How did you cope?
One case that stands out as particularly difficult involved a young child who was brought to the emergency department after being struck by a car. The child's injuries were severe, and despite the team's best efforts, they ultimately did not survive. What made this case especially challenging was not just the tragic outcome, but also the parents' reaction. Their grief was raw and overwhelming, and witnessing their pain was incredibly difficult. I found myself deeply affected by the situation, and I struggled to reconcile the clinical aspects of the case with the profound human tragedy unfolding before me. After the child passed away, I spent some time with the parents, offering comfort and support. I listened to them as they expressed their grief and anger, and I simply sat with them in their sorrow. I didn't try to offer platitudes or empty reassurances but rather focused on being present and offering genuine empathy. This case stayed with me for a long time afterward. I found myself replaying the events in my mind, questioning whether there was anything we could have done differently. I felt a deep sadness for the child and the family, and I struggled to process the emotional impact of the experience. I talked about the case with my colleagues, and we debriefed as a team, which was helpful in processing the emotions collectively. I also found it beneficial to talk to a therapist. It provided a safe space to explore my feelings and to develop strategies for coping with similar situations in the future. This experience taught me several important lessons about myself and about trauma nursing. First, it reinforced the importance of self-care. I realized that I needed to prioritize my own emotional well-being so that I could continue to provide compassionate care to my patients. I learned that it's okay to feel sad and affected by these cases and that seeking support is not a sign of weakness but rather a sign of strength. Second, this case highlighted the importance of presence. I learned that sometimes, the most valuable thing I can offer to a grieving family is simply my presence, my willingness to listen, and my genuine empathy. Finally, this experience reinforced the importance of setting boundaries. While it's essential to be compassionate and empathetic, it's also important to protect my own emotional well-being. I learned that I can be present for my patients and their families without taking on their grief as my own. Moving forward, I will continue to prioritize self-care, seek support when needed, and focus on being present for my patients and their families during their most difficult moments. I will also remember the lessons I learned from this experience and apply them to future situations, knowing that while I can't always change the outcome, I can always offer compassion, empathy, and support.